meals for seniors, COVID tests, vaccine sites, internet, broadband, and getting Chromebooks to kids. She did everything during the pandemic, and we as a team, with her leadership, did everything all at once, just like she said. And so, please, with Cindy, can we all give her the loudest, warmest welcome to Supervisor Cindy Chavez.
Amy, amazing. Amazing, amazing. And let me first start by saying that I'm home today in my backyard because I got COVID, and we want to make sure everybody's healthy and safe. And so I'm not with you face to face, but I am absolutely with you in every other way. I want to start by saying how grateful I am, Amy, to you and the entire District 3 team. You guys did an amazing job pulling this together, and I'm so, so grateful to all of you and to all of the volunteers that are helping today. Thank you, thank you, thank you. And for those of you in person, thank you for showing up. Those of you online, thank you for being present. We really appreciate it. Let me start by saying why today is so important. We began doing these leadership summits really many, many years ago, in part because so many women were asking to be connected to each other. And we were thinking, what better way than to really get a chance to get people face to face, to look at issues around leadership and policy initiatives and helping women move up to their next thing, whatever that was going to be. And one of our great partners here has been the community colleges. We've hosted these at community colleges, and also to San Jose State. I'm very grateful to them for letting us be in their home today, which is just reminds us all it's all of our home. But today our theme is very important, and I just want to read it. Women's rights, confronting a crisis head on. Many of our themes have been much softer, much more much more warm. The reason this one isn't warm is we're in times that are very challenging. And we knew that one of the best ways to address challenging times was to be able to have honest, thoughtful conversations with each other that would allow us to do more to protect the community that we love so much, and not just to act from a perspective of defense, but what is it that we want to see? How do we expand childcare in our community? How are we making sure that every single household in our community has broadband, especially those for families that are lower income? What is it that we can do to make sure that every family has the nutrition they need? How do we make San Jose and Santa Clara County the most socially mobile place in the universe? It should be. We are on the tip of the spear. We're about living in a very dynamic, very pluralistic society, and our ability to live together, thrive, and prosper rests on one very basic principle. Are we treating everybody equally? Are we treating everybody fairly? And we know right now that across this country, there are attacks coming at women every single day. So today is about recharging. It's about getting the skills we need to not just fight back, but to push forward. And I hope all of you that are here today or watching online are ready to do both things. Push back, but move forward. We're not going to let any barrier stop us from doing what we know is right for our children. Let me just wrap up with this point. Amy is a new mom, and she's got this daughter named Joey who's just amazing. I mean, just so chubby and just the kind of cheeks you want to pinch. Just this beautiful, beautiful new person. And I think about her, and I think about all of the girls that are being born today, and all of the boys, that we want to live in an environment that is so respectful of people, that there is no dynamic that says one is less than another. The only way for us to make that happen, for Joey, for Harper, for so many other girls, and for my own son Brennan, is to make sure that today we push back and we push onward. Thank you all very much for joining us, and I'm going to be popping in and out today. Thank you, thank you, thank you. I'm grateful.
Thank you, Supervisor Chavez. And now I would like to introduce our next speaker, someone super busy, yet has always made the time to make this summit extra special. And he's probably tired of me asking him about pens. But I would like to introduce Mr. Michael Elliott. He first joined VMC Foundation in 2007 and served as the organization's chief operating officer beginning in 2014. During his tenure at VMC Foundation, Michael has led major capital campaigns, managed multi-million-dollar grant projects, and launched numerous programs. Beginning in March 2020, he coordinated daily COVID-19 relief activities at the foundation and secured over 5 million units of protective gear for the frontline health workers. He's bent over backwards and forwards to lend a helping hand, and there's been no better partner for this summit than the VMC Foundation led by Michael Elliott. Please welcome Mr. Michael Elliott.
Thank you, Amy. Good morning, everyone. I, too, was going to lead a dance routine, so now I'm sort of lost on what to say, because we did one already. It's so nice to see you all here bright and early on a Saturday morning. I'm Michael Elliott from the Valley Medical Center Foundation. We are the very proud fiscal sponsor for this event, so thank you. Well, thank you. And to the many sponsors and other organizers, and to the Office of Supervisor Cindy Chavez, and to Amy in particular, you've done a phenomenal job during a very busy season, so thank you for your efforts bringing us here today. I was very sad, of course, to hear that the supervisor couldn't be with us, and I think it's what I've been reflecting on this morning. I know this is true for me in my work in the last 2+ years, and I'm sure it's true for all of you in this room, that Cindy has been there for us and touched our lives and touched our work. So today is a day when she can't be here with us. We can show up for her, and we can do that by having an amazing conference and doing what she was hoping we would do, which is to make connections, to have deep conversations, and to build for a better future. So proud to be with you today. Thank you so much, and I look forward to meeting some of you at the rest of the conference. Thank you.
Thank you, Michael. And of course, we wouldn't be in this beautiful venue without San Jose State University, and so I would like to introduce our next speaker. And I want to also thank the team at San Jose State University, Jennifer, Edwin, Donna, Eric, Christine, Aaron, you've all been wonderful. And also, if anyone is looking for a lactation room today, the Gender Equity Center has made that available for us downstairs, just right downstairs, and we have a lactation room available. And I'm also proud to say that this summit we also offer childcare, and because of Supervisor Chavez, we just want to make sure we're as inclusive, as open, and as thoughtful as we can. So again, if there's anything else that you need, just let us know. But back to Dr. Perez. He was appointed interim president of San Jose State in November 2021 and assumed the presidency in January 2022. He now leads the oldest public university in the West, the founding campus of California State University System and Silicon Valley's only public university. He has been described as a bold leader with a long-standing commitment to improving student achievements, demonstrated through his many years of service at Sacramento State. So if you could please put your hands together for Dr. Stephen Perez.
Thank you. It's quite the maze to get up here. Thank you, Amy. Thank you, Cindy, for your leadership, for pulling this together. Thank you, Michael and the VMC Foundation, for sponsoring this. We are so proud to be able to host this. I've followed Cindy a handful of times when speaking, and sometimes it's a little daunting because she does such a fabulous job talking about the issues and talking about what we're doing. But she also highlighted some things while she was talking that I also want to highlight here. This is an unbelievably important event, an unbelievably important conference because of the time in which it's happening. And as she said, the theme is pointed and it's strong, and it's because it needs to be. Because women's rights and thus human rights are under assault across our country, and we know they are around the world. I am so proud to live in a city, to work at a university, and to live in a state that is upholding the rights of every individual that lives here, and will continue to do that, and we will continue to do that here at San Jose State. I'm so appreciative of you all being here to talk about these issues and talk about how to support each other and how to continue to make sure that we support each other going into the future. So thank you all for being here. Welcome to San Jose State. Let me ask, how many Spartans are out there right now? That's great, but Cindy said it right. This is San Jose State's university. We are the public university for this region. We have over 300,000 living alums. They're all out in the community. You just saw the hands of many of them, but today you're all Spartans. Today you're here, you're home, you're at your university. Please don't be a stranger. Come back as often as you like. We are part of our responsibility and our job is to be a resource for our community, for our county, for our citizens that live around us, and it's convening events like this and hosting events like this that we ought to be doing more often, and we look forward to doing more often. Thank you again for being here. Thank you to everybody that put the work into organizing it. It's immense, but if you look around, look at the impact that you're having. You've got hundreds of people here. I'm sure there's millions of people online that are watching at the same time, and we're going to have really, really important conversations today. So thank you all for being here. It's a great day to be a Spartan, and welcome to San Jose State.
He's right. There are millions of people watching. So let's get today started. Just as Dr. Perez mentioned, it is a very important day, and there are a lot of people who wanted to be here today but couldn't be here. And so we have a few special video messages. And first, a special message from Congresswoman Zoe Lofgren.
Thank you for inviting me to speak at this important annual summit once again. You've made this year's theme Women's Rights, Confronting a Crisis Head On. And yes, that is an on-point theme. We certainly do have a crisis. The Supreme Court's Dobbs decision is the first ever from the Supreme Court to try to take a constitutional right away from Americans. It's worth noting that this is the result of decades of efforts by the Republican Party to place one far-right ideologue on the Supreme Court after another. And it honestly illuminates the tragic consequences that elections can have. The far-right Supreme Court was put in place because of Republican control in the Senate and the White House in the recent past. Now, I understand your theme that we, women of America, need to confront this crisis head on. And this November, Californians will have an opportunity to put Roe v. Wade in the state constitution. That's really important. And I hope that the women and yes, men of this state will take the opportunity to enshrine that constitutional right in our state constitution. However, it may not be enough. As we know, abortion is legal in California, but if MAGA Republicans in Congress get their way, that's not going to stay the case. In fact, Majority Leader Mitch McConnell in the Senate said a few weeks ago that abortion would be an issue. And then, of course, Senator Lindsey Graham just introduced a bill to outlaw abortion and preempt states. So we know that their extreme anti-choice agenda is on their minds and what they attempt to do. It's very interesting to me that Republican candidates who have been anti-choice extremists throughout their career are now trying to edit their websites to prevent voters from finding that out. So I think all of us who care about freedom need to make sure that our voices are heard and that people know the truth and make decisions based on the facts. It's worth noting that the House of Representatives has already passed the Women's Health Protection Act, which would codify Roe v. Wade. Now, as you may know, in addition to abortion, the Dobbs decision threatens other fundamental rights. It's based on the theory that there is no right to privacy in the Constitution. Well, guess what? That means that other constitutional rights that matter to us may also be at risk. When you think about the Griswold case, which allows people access to contraception, the Oberfell case, which allows people to marry who they wish, permits gay marriage, even the Loving case, which permits interracial marriage, because Americans have privacy rights, Americans have freedom, those all could be at risk. So I think it's important when we go to the polls this fall that we address, there's a lot of issues. There's huge, important issues, climate change. There's challenges that our families face with inflation and on and on. But the issue of freedom for women in this country is on the ballot this November. You know, we have, along with Dobbs, other challenges that women in particular face. Maternal mortality in our country is among the highest of any developed nation in the world. That's completely unacceptable. And it's even more dire among disadvantaged communities. We need to address maternal health crisis. We also know that women often shoulder a disproportionate share of child raising and household labor in our society. We need stronger policies to extend childcare options and lower the costs. Now, as many of you may know, we had those issues addressed in a bill that could not make it through the United States Senate. I'm hoping that we get 2 more Democratic senators and frankly retain our majority in the House, in which case all of the measures that we passed that got stuck in the Senate, we hope will then be able to move forward, enhancing health for women, advancing rights, advancing the well-being of children. We also need to address pay equity for women. Today, women still make an average of 83 cents to every dollar that men earn. And that's part of why women can be impoverished in our country. You know, I do think we're at a turning point for women in our United States. Either Republicans will impose their extreme views on American women, forced pregnancies, denial of contraception, or women will continue to enjoy the constitutional freedoms that we have enjoyed for these past many decades. We need strong leadership from people like you who aren't willing to be bullied, who won't stand down when Republicans want to take their rights away. I appreciate your including me in this summit, although it has to be virtual given the congressional schedule. I can't wait to hear some of the issues coming out of your summit, and I look forward to working with you on them, hoping that we will have a chance to implement some of your policy recommendations next year in a new Congress that has new hope for America. Thanks very much.
Thank you, Congresswoman Zoe Lofgren. And did you hear that? She said, we need strong leaders like everyone here in this room. And I think this summit is just a great start for us all to get connected, to build on that leadership and to build as a community. And we have one more special message from our Attorney General, Rob Bonta, who has been a fierce champion for women's rights.
Hello, Women's Leadership and Policy Summit. Rob Bonta, California Attorney General here, and I'm honored to join you today for this convening on reproductive freedom. Thank you, Supervisor Chavez and the Valley Medical Center Foundation for hosting this critical summit. I'm inspired by the activists and leaders here, and we need all of you in this room more than ever before. A radical Supreme Court decision has put lives in danger. Millions of people are suffering. From Idaho to Indiana, Tennessee to Texas, politicians are now further regulating bodies and curtailing freedoms. 1 in 3 American women have already lost abortion access. This hurts us all, but especially those with the least means and the least resources. We're in a new, uncharted level of disparity, and I fear it will only get worse. This moment is bleak, but paradoxically, I also believe this moment brings hope. In recent days and months, I've met with Planned Parenthood leaders from across the nation. I've met with youth activists and even the vice president to discuss moving forward in this post-Dobbs reality. Despite all the despair, despite the setbacks, I look at my daughters, I look at my son, I look at the youngest generation, and I see a brighter potential. I see a generation of leaders who are fighting for equity and justice. I see a generation who understands that reproductive rights are human rights, a generation that understands the importance of healthcare and social safety nets. They inspire me to do more, and I am. As California's Chief Law Enforcement Officer, I'm using the full force of the law and the full authority of my office to protect reproductive freedom. We are putting a stop to dangerous Trump-era rules, challenging unconscionable abortion bans, putting misleading crisis pregnancy centers on notice, issuing first-in-the-nation guidance to ensure California law is not misused to prosecute pregnancy loss, and far beyond. This moment requires action by all of us, and I know we will continue to answer the call. Each of you are today, and I proudly join you. This is a dark moment for our nation, but together we will be a bright light for freedom, rights, and safety. Thank you again, Supervisor Chavez and Valley Medical Center Foundation. Enjoy today's summit, and let's get ready for the fight ahead.
Thank you so much for that kind message, Attorney General Rob Bonta. I hope you're online watching us. Before I turn it back to Supervisor Cindy Chavez, I do want to note the gifts in the chairs when you arrived. I just wanted to point out, because it's not apparent to most people, that inside there's an alarm keychain. So if you're walking in the middle of the night, or if you're somewhere you don't feel safe, just have it in hand and you pull it. I tested it. I scared my husband. It works. We also have gifts from the Vietnamese American Service Center, from our Public Health Department, from our Office of Labor Standard Enforcement, and the tote bags from all our sponsors. And there are shirts outside. Please grab a shirt, wear it whenever, wherever. I still have the shirt from 2019. Don't judge me. It's nice. We have stickers on the tables, and the program booklet will tell you where your workshops are. And that is it. And I'm going to turn it back to our Supervisor, Cindy Chavez. Can you hear me? There you are.
Thank you. I'm so excited to get to thank all of the amazing sponsors. And I would love it if you would all go wild with applause after I name all of them, because they're amazing. So first of all, we could not do this without our partnership with the VMC Foundation. Michael Elliott and your team, you are a blessing. Valley Water, VTA, Planned Parenthood, Community Health Partnership, the Silicon Valley Community Foundation, First Five, Destination Home, Working Partnerships, IBEW 332, and the Health Trust. And Young Art is doing an in-kind donation. And I want to say a very, very special thank you to the county of the Office of the County Executive for the translation services from the Language Access Unit, and our security team led by Doug Feliciano. Now go wild. These are amazing contributions, and they made today free for everybody. Yay. Are you all going wild? I can't tell. Great. Thank you. Thank you. Thank you. Thank you. And I would love it if, Amy, if you could model the t-shirt a little bit later. It's now my great honor to introduce our keynote speaker, Ms. Stacy Cross. Stacy has had more than 20 years of service as Planned Parenthood CEO and 30 years in healthcare administration. She is leading Planned Parenthood Monte, the largest Planned Parenthood affiliate in the nation, at a critical time in our country's history. She's been active in protecting healthcare access for communities and patients, many of whom live at or below the federal poverty level. Planned Parenthood Monte improves and transforms the lives of over 220,000 women, men, and children every year throughout mid-California and northern Nevada. With over 30 health centers, they provide a range of reproductive and primary healthcare services, including birth control, pregnancy testing, and options for counseling, STD testing, and treatment, HIV testing, breast and cervical cancer screening, abortion, pediatrics, and adult primary care healthcare. And they're able to do all of this under Stacy's amazing leadership. Please welcome Stacy Cross.
So I am honored to be here today. If anything, women are very flexible, so I'm happy to be here, and I know Cindy is very sad not to be here. It was so great to see all of our leadership here. We are really blessed to live in a state where our leaders are standing strong for women and those seeking reproductive health care and abortion. As Cindy mentioned, we are the largest Planned Parenthood in the country. We operate 6 health centers here in Santa Clara County. So, can somebody move the, it's not moving. Next slide. There we go. This shows our region. I'll put this down here. This shows our region. We cover half the counties of California and 13 of the 17 counties of Nevada. It is a huge region, and what makes us the largest Planned Parenthood in the country is the number of patients that we see. Next slide. Okay, you really can't see that, but I'm going to talk a little bit about it. So last year, we saw almost 400,000 patient visits. 80% of our patients are women, 65% are under the age of 30, 80% are people of color, and 68% live 100% below the federal poverty level, which is $12,760, which is really hard to sustain in this area, as you know. We provide a wide range of services, and Cindy kind of talked about them, but I want to highlight a couple of them that weren't mentioned. One, we do gender-affirming care at every one of our health centers. We made a decision during COVID that even though we had it at a few health centers, that we would really expand that. We also do vasectomy services, and that's important for a whole variety of reasons, as everyone in this room knows. We're just getting ready to start prenatal care again. We provided this in the past, but it's getting ready to start in about a month in several areas. And we also provide behavioral health, which is really important because when we see our patients right now, everyone right now is traumatized by the last couple of years. What's happened with the leak and the decision and climate change and so many other things, behavioral health is critical, and we're really proud to provide it. The reason I came to Planned Parenthood Monte was because, one, we do more primary care than any other affiliate in the country, and what I really liked about that is it normalized abortion care and helped take the stigma away. We see, when I walk into our Mountain View clinic, where we speak 10 languages there, we have a patient that's getting a newborn check. We have a patient that's getting a prostate check. We have a patient that's getting an abortion. And that's really important because it normalizes and destigmatizes abortion. Next slide, please. This is the numbers that we were just going through. And it's really important that one thing to look at, which is that 20,000 of our visits were abortion services. That number is going up, but I think one thing that most people do not understand is that abortion, this is from FY21, it was about 5.2% of the services that we provide. We provide more contraception than any other organization in the entire country. Next slide. So this is where we are today with bans. And I say today because everything's unfolding. Just this week, there was a legal action in Indiana, and right now, abortions are being provided in Indiana. But just this week, also now in Arizona, the abortion ban is in place. So it's unfolding every day. We're really keeping track of what's happening each week across the country, and it's really, really, really quite frightening. When we think about the bans, there's various bans, but there are anywhere from total bans to 18-week bans, which is one of our neighbors, which is Utah. We know that even though right now they have an 18-week ban, we know that that will probably not last, and there will probably be a total ban, and we're preparing to be a partner with them. Next slide. I hate to have you see this picture this early in the morning. I apologize. But just last week, Lindsey Graham and Chris Smith from New Jersey, who I actually know because I'm from New Jersey, introduced language to have a 15-week ban. Now, this removes any doubt, and some folks have already addressed this, any doubt that Republicans really wanted it to be a state issue. And so we're worried about this, but as you already heard from Zoe, people are starting to backtrack on what they have in their social media, even folks that had strong stands against abortion, because they know that this is not something that is good for our communities, it's not something that is good for women, and is not something that is good for our families. So it's really important that we know this. As Monte mentioned, 1 in 3 women right now in the United States no longer have control over their bodies. I really want that to sink in right now, and that's only with 18 states. Right now, 1 in 3 women don't have control over their bodies. That means in those states, Arizona, Louisiana, Texas, as I'm going to talk about, all these states, we, women and people seeking abortions, are second-class citizens in the United States of America, and that should send a chill down your back. But I'm going to talk about what you can do to act now. We also knew that this was not really about abortion. We always knew that this was about power and control over us. Because when the leak happened, as Zoe mentioned, when the leak happened, we really saw what they wanted to do. Everything protected by privacy is at risk. It's abortion, it's birth control, it's marriage equity, it is interracial marriage. And I know I get asked a lot about when did I know that Roe was going to get overturned. And I knew the morning of the election of the previous president, November 2016, because we had already had a Supreme Court justice ripped out of our hands. We always prepare as Planned Parenthoods to be ready for Roe to get overturned. And we knew that this was going to happen. So we have been preparing for years and years and years. Every Planned Parenthood and affiliates across the country are prepared. At Monte, we are prepared to see anywhere from 250 to 500 additional patients a week. Next slide. So, not to put a downer on your morning, but this is what we believe is going to happen in America. Of course, we could have some miracles. We could really, as Zoe mentioned, we could win back and get the majority in the House and the Senate, and we could pass the Women's Health Protection Act, which would codify Roe in our Constitution. But right now, this is what we're looking at. 26 states could go dark. Actually, I talked to a friend of mine that's a CEO in Minnesota yesterday, and Minnesota has been a stronghold, but it may get overturned there also. So the whole center of the country could go dark. So every state that you're looking at is states where abortion will be banned or have some form or fashion of it being banned. And remember that birth control is also at risk, and I wanted to give you an example of this. And I've told this story many times. My niece knows I tell this story, so don't worry that I'm going against her privacy. She graduated from Columbia this year in May. She went back to Tennessee, where she grew up. She got there in May, and she had an appointment to get an IUD. And her doctor called panicked because she was supposed to get it in about a week and a half, and he said, I need you to get in today, because if decision day happens on Monday, I can no longer put an IUD in you. And this is true in multiple states, including emergency contraception, which is what we call the morning after pill, which you can take up to 5 days after you've maybe had a condom break or something. In both Missouri and in Texas, the Attorney General requires you to have a verified rate for you to have access to emergency contraception. That's just unbelievable because most people that have had a sexual assault, they have 5 days to get to a police station. They have 5 days to make an accusation, and it's just not going to happen. What if you just had a condom break and you don't want to get pregnant? In these states, it's going to be at risk. And so it is a very frightening time, and if you are not ready to act and to stand up and to fight, I hope I will inspire you to do that today. Next slide. So many people ask us when we started getting out-of-state patients. And actually, at the end of June, when Dobbs happened, we did see an increase. But we have been seeing out-of-state patients for a long time because there's all kinds of restrictions on abortion. There were already all kinds of restrictions and barriers on abortion. If you remember way back when COVID hit, many states said that abortion was non-essential health care, and so we had patients flying in from South Dakota, from North Dakota, all the states that it was non-essential, including New York City during that time. They were flying, if you can imagine, flying out of New York City, which was really, the numbers of COVID were skyrocketing, but they flew here to get abortion. What people don't understand is making abortion illegal does not make it go away. It makes it unsafe, and it happens to also impact women's and people seeking abortions' fertility. Next, and this shows, again, we saw a 101% increase from July and August of 2021 to this year, 2022, we've already seen a 427% increase of patients coming in from out of state from last year to this year, just at the start of this year. I also want to remind you that these are not just numbers. Sorry, my mom's calling. She's 93. I can tell you she's pissed off about what's happening right now. But I want to give you a patient story to make it real, to make you think about that these are real people. So we had a patient that drove 17 hours one way to get a procedure with her 2 kids, single mom. She then had her procedure and drove 17 hours back because she's supporting her family. She's working 2 jobs, and she had to get back to her family. This is what is happening in America when rights have been taken away. And it's, as you can see from the slide, the likelihood is that it is only going to get worse. Next slide. So Texas. I'm sure you all know about what happened in Texas this September, which was SB1. SB1 banned abortion at 6 weeks and then started a bounty hunter. So anybody that could help a patient get an abortion in Texas over 6 weeks, the Lyft driver, somebody, a friend helping them, the provider could be fined $10,000. So we quickly saw patients coming in from Texas, but we have always seen patients coming in from Texas for a long time because they already had restrictions and barriers to care. So we've seen an increase. Now we're up to about 36% of our patients from out of state are from Texas right now, and the number is getting higher and higher. And what just happened yesterday in Arizona with the ban now going back in place, I'm sure we're going to see more patients. I talked to my peers from Southern California, and they were all preparing for a huge influx of patients. Next slide. So one of the things that we have to think about is even in California, we have abortion deserts. That means that people have to travel great distances. It depends on, I lived in Montana a long time, so 100 miles doesn't seem far to me anymore, but 100 miles traveling here is a long, long time. But we have people traveling lots of miles to get an abortion, even in California. And we, in the Central Valley, where we have the most disadvantaged areas, we have 11 health centers and growing. We are expanding our buildings, brick and mortar building space as a result of what's happened, and we're growing our staff. And we're going to hear, but there's a panel next with one of our providers, speaking about all the things that we're doing to make sure that we're supporting our staff and getting more staff trained to be able to provide abortion services. Next slide. So the Future of Abortion Council, which Monte mentioned, this was in the fall when we knew SB 8 happened. We knew that Dobbs was on the docket for the Supreme Court. 45 organizations, including their 7 Planned Parenthood affiliates in California, got together with multiple organizations and united to do what we could do to protect our patients here in California, protect our providers that were providing abortions here in California, and also make sure when our patients were coming in from out of state that they were protected also. So it was lots of bills and a variety of things to be able to support the work that we're doing here. And what we didn't want to do is we didn't want to take away from the care that we're currently providing our patients. So the resources, the protection, all of this was vitally important. And getting all these organizations united and working together with one North Star was really amazing. The governor and our pro tem were really supporting this, and we're excited to have this work happen. The next slide shows that one of the things that they really wanted to do, one of the recommendations was to have, next slide please, was to have a site where patients that wanted to come to California could come and seek care and know where to go. There is a site up right now, and you have to put in a zip code. But for most of us, like if I had to travel to Texas, I wouldn't know what zip code I was landing in. So this site allows you to put in a city of where you might want to go. And Planned Parenthood Monte is locating our sites near, we have several sites near airports. We're doing another site in Reno, Nevada that's going to be close to an airport. We broke ground a couple of weeks ago. We're building so that we can triple our capacity and also be able to do inpatient surgical abortions at that site. We have to have sites located so that it's easy access for patients to get to. But this site does all kinds of other things. It talks about their rights. It talks about funding and how they can access travel costs and housing costs and cover the cost of their services. It also is a protected site. So if somebody from Missouri wanted to track that a patient had looked at the site, they've made it so it's impossible for that to do. Patient privacy is getting more and more and more challenging all the time. I use Missouri a lot because my daughter-in-law is from Missouri, and women in Missouri are crossing state line using cash to get pregnancy tests because they're afraid to have pregnancy tests in their state right now, and certainly afraid to use a credit card to do that. So it is, we have a lot of work to do, and we have to be prepared to tackle it. Next slide. A.D. Monte talked about this, and this was something that it was a couple of weeks ago, we got all of the Planned Parenthoods from across the country that are going to be what we call access states, and that means there's not going to be a ban in that state. So it's California, Nevada, Washington, Oregon, Minnesota currently, all the states. There's about 15 affiliates, and it covers 24 states that could possibly be safe. And we talked about a whole variety of things of what we could collectively do together with safety for our patients, access for patients getting to these states, protecting our providers, because right now, one of the concerns that we have is that through the fabric and the bills that were passed as a result of it, our providers are protected in California. What we don't know is if they then go to Missouri or to visit a grandchild or to Texas or any of these banned states, Idaho, South Dakota, North Dakota, are they going to be protected when they land on that ground? So we are doing more and more things. We've definitely seen more security issues happening across the state. And one of the things I was talking to someone earlier about that no one seems to think about. But when you ban abortion in a state, you ban the ability for medical schools and residency to also teach abortion. And not only do they not know how to do an abortion, if you're going to be a rural physician in one of these states, you do not know how to save a person's life that's having a miscarriage or an ectopic pregnancy because you have not had that training. Yes, the domino effect of this is horrific. So we're seeing more and more residents and medical students coming to our state for training and to all access states. And that was one of the things that we talked about, how we can do that. The other thing was Secretary Becerra also spoke at that. And two of the things that were really great about this was that we talked about Roe as the floor, that we all accepted Roe as the floor, and this is the law of the land and across our country. And many states, not in California, had barrier after barrier, 24-hour waiting period. They had to talk to somebody at a crisis. In South Dakota, they had to talk to somebody at a crisis pregnancy center to hear all the misinformation before they could get a procedure. All these things. No longer are we going to accept Roe is the floor. They just woke a sleeping giant, and we are ready to do more. And everyone collectively has to be together, needs to do that. Next slide. So this was already discussed, but I think it's super important that I talk about it. When the leak happened, we knew that not only anything protected by privacy in the U.S. Constitution and also in our Constitution was at risk, which included marriage equality, contraception, abortion, interracial marriage. So Prop 1 is a constitutional amendment to protect abortion, codify it in our state constitution, but it also protects a right to use or refuse contraception. And that's super important that we have in there. And it's really important that we pass this, and we pass this with an overwhelming majority. It is a yes vote, and we need to make it happen. Since this is a women's summit, and I see that we have lots of men that are here supporting us, which is super important, we are more than 52% of the population. Women are registering to vote in droves, and we need to show our strength, our resilience, and we need to really get out and vote. And this needs to happen in California because what happens in California happens in other states. Next slide. So these are all the other ballot initiatives across the country. One was Kansas. Yes. I don't know if you know what happened in Kansas. It was amazing. We are supporting Planned Parenthood Monte, or actually Planned Parenthood Advocates Monte, supports every one of these ballot initiatives. Planned Parenthoods across the country support ballot initiatives in other states because what happens in Kansas can happen here. What happens in Texas can happen here. So we all support them. So Kansas was a no vote, and it was really important that people got out, and it was fantastic, and it was a beacon of light for the rest of the country that got shut down very fast. We also have one in Kentucky, which is a no vote. It would permanently ban abortion. In Michigan, there is a ballot initiative, Michigan, there is a ballot initiative very similar to what we're doing here. It's trying to get something off the books that's been in since the 1800s, and it will codify abortion and birth control, and also anything around pregnancy in their constitution. In Vermont, they have something very similar to us. And then in Montana, which I was a CEO in Montana for a long time, they have a fetal personhood ballot initiative, which would essentially, it's using junk science to essentially ban abortion at any aspect of a pregnancy. So it will go after the providers for $50,000 and up to 20 years in jail. And that is very horrific. And finally, you probably are saying, well, she said she'd give us some ideas on what we could do and how we could help, and I want to tell you what you can do. This is the next slide. What I want you to do is I want you to vote. And I talk at rallies all the time right now, and people are saying, I don't want to vote. Voting doesn't matter. Voting matters. What Zoe talked about, we have to get the Senate back. And of course, what we really have to have happen first when we have those majority is we have to pass the Voting Rights Act. Without the Voting Rights Act passing, we cannot, I have a little pinkish hat on here today, sorry. We have to pass the Voting Rights Act, and we have to pass the Women's Health Protection Act. So it's really important that we vote. We have to have champions in our offices. We, from school boards to mayors to county supervisors to Senate and House and President, we have to have champions. We also want you to donate, not only to organizations like Planned Parenthood, but every state has an abortion fund. And the abortion fund is Access Reproductive Health, right, Deanna? Yes. And here in California, and everyone has one, and you can help pay for people for their services, their travel, and their housing. Really important. And finally, disrupt. We want you to disrupt. You know, as we know, by the time you're 45 years old, 1 in 4 women have had an abortion. So that is a lot of us here. A lot of us here have had an abortion in our lifetime, and we need to destigmatize it. Abortion is health care, and we need to make sure that everybody understands it. When in Texas, when they took all the funding away, this was years ago, when they took all the funding away for health care for women, it impacted cervical cancer screenings. It impacted maternal health. It impacted unplanned pregnancies. It skyrocketed abortion rights. It also impacts the health of families, communities, and the states. And so people in Texas then opened up and offered free sites for Planned Parenthood to come back because they didn't care what their government had done. They knew that women were dying, it was impacting families, and they needed to do the right thing. Thank you.
And we're going to turn it back to Supervisor Cindy Chavez.
As always, amazing, amazing, amazing. And I just want to say how really, really lucky we are that we got Stacy here with us. One, that she's running Planned Parenthood Monte, but two, you just got really an education about what's happening in the country and what we can do at a local level. I just want to share all of my gratitude with Stacy. We were going to do a fireside chat, but I know that you've got your workshops coming up, and so. And Stacy, by the way, you answered most of my questions, so we're in great shape. But thank you, thank you, thank you. Amy, I'm going to turn it back over to you to get everybody to these workshops. And I want to say to all of the panelists that are with us today, thank you so much. You guys have got a great day ahead of you, and I will be joining you later in the day. Thank you. Thanks, Stacy.
Thank you, Supervisor Chavez. And a round of applause for Stacy Cross. And as you all heard, today is important. It's serious. We have work to do. Are you ready to disrupt? So I will let you know where the workshops are, and just quickly some logistics. We will now break into our workshops that everyone already signed up for. I will let you know what rooms. But please be back here by 11:45. Lunch will be prepared. We have boxed lunches coming our way, vegetarian, vegan options. The Vietnamese workshops will be in room 1B. Spanish workshops in room 2B. Women's overall health and well-being is in 2A. Women's leadership and economic security is room 3A, 3B. Reproductive justice is in room 4A. Implications of Dobbs v. Jackson is room 4B. If you get confused, it is in the program booklet of where to go, what to do. I will be here if you have questions. And thank you so much. And get ready to learn, grow, and disrupt. Thank you so much.